DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.
Hey folks, welcome to DocTalk. We're going to have a familiar face on the show today. Dr. Dan Loy from Iowa State and the Iowa Beef Center is going to be here. We're going to talk about implants in cattle. Stay tuned.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodirus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson. I'm here with Dr. Dan Loy, who's a friend and colleague. He's the director of the Iowa Beef Center. He is a staple in ruminant nutrition, growth physiology of cattle, and much more. He's been a mentor to me, and it's great to have you on the show.
Happy to be here.
Great, great. We're going to talk about something that, there's been some controversy over implants because we've got some new regs coming, but I thought, well, let's remember why we use them. Mm-hmm. And talk about it, and Dr. Loy has done probably as much implant research and evaluation as anybody I know, and so let's start out and just go through the segments, but let's start out with calves on the cows.
Yeah, well, and that's a great place to start, and it's actually one that probably producers could take a lot more advantage of. In the feedlot, I'd say 97% plus of those cattle get an implant, and in the cow-calf industry, it's a very small percentage, and they're bypassing a technology that is probably in terms of dollars per dollar invested returned is one of the highest returning technologies that are out there.
Yeah, and it's easy. And if you're branding and you're giving them a vaccination, they're right there.
It's the perfect time. And when calves are castrated, you take it out, take hormones out, put it back in to replace it, and you're going to add 30 to, in some research, as much as 40 pounds of weaning weight.
That's amazing. And if we're getting $2 a pound
or three,
yeah, now we're talking $80 to $120 a head.
Right, exactly.
On an implant.
And for a very small investment.
Right. So that 3-4 months of age is about the right age. Which calves are if we're sitting down and we're a commercial herd, because let's take seed stock out. We're not going to implant bulls. You should never implant a bull intended for breeding. But we've got steers and we've got heifers.
Right.
So there's no disadvantage to implanting a steer.
No, absolutely. Any animal that is a steer should be implanted. No question about that. And heifers, you might want to avoid implanting heifers you're going to keep. But on the other hand, if you do implant a heifer, I wouldn't stop. That wouldn't stop me from keeping that heifer.
Right, and just use a calf implant, right?
Right.
Calf implant on the heifers, because that's what we've always said is that, hey, if if you're going to keep them for replacement, you don't need the growth.
That's right.
And if you don't know, you should implant them, and if you know for sure you're going to sell them, you should dang sure implant them.
Yeah, for sure. And there's 3 calf implants. There's 3 major companies that sell implants. There's one from each of those companies, and just choose the one that fits your system best.
Yeah. And so, any other, cows, any other implications of implants with the calves?
Well, no, I think there's some research that shows if you implant cattle, they'll be bigger for life. And your mentor did some of that. I did some of that. And so, you know, if you know you're going to keep them for cows, that might be one reason to avoid implanting. But again, the data shows that if you do implant them, that's not a reason not to keep them back.
Never implant a bull. Implant all your steers, and make decisions on your heifers based on whether you're going to keep them or not for replacements. But for sure, if you know you're going to keep them, no need to. But if you don't know, implants won't hurt your repro physiology or outcomes, right?
Right.
Great. All right. When we come back, we're going to jump into stockers and grow yards. This is Dr. Dan Loy. We'll be right back. Hey folks, welcome to Cattle Intel by Neogen. And today we're talking again about biosecurity. And one of the big practices of biosecurity is introduction of new animals to your herd. If you have a closed herd and you're going to bring new animals in, it's best to isolate those animals and quarantine them for at least 30 days. The reason why we isolate and quarantine for 30 days is because most disease processes will be cleared within 30 days. If you want to use diagnostics to test for certain diseases like BVD, you can do that, which will speed the quarantine process up, allowing you to make herd introductions. But isolation and quarantine is a great practice for biosecurity. Thanks for joining us on Cattle Intel, sponsored by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
Founded by farmers, for farmers, United Patriot Coin stands with you. Diversify your financial portfolio with precious metals, a smart investment for uncertain times. You've worked too hard not to protect your assets. United Patriot Coin, precious metals for a secure future.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Dan Loy. We're at Iowa State University in the Department of Animal Science, where Dr. Loy serves as the director of the Iowa Beef Center. And we're talking implants. And so as we move to the next production stage, we're going to start increasing the dosage rate and combining some products, right?
Right. As we start looking at developing an implant system, a lifetime system, one general rule of thumb is that as you move up in rate of growth and kind of move up the system closer to finishing, that you increase the potency of the implants that you're using to kind of match the potential growth that those cattle have.
So, like we were talking about, most of the calf implants are just estrogen, right, or an estrogen analog or something of that nature. Now we're going to start introducing TBA.
Right. So yeah, so estrogen, there's really two basic steroid hormones that are used in implants. There's the estrogen compounds, and then there's androgen compounds, which is TBA for trenbolone acetate, is the androgen that's used in all of these, and it's used because it provides the growth and the anabolic effect, but without all the secondary sexual characteristics that you see.
Yeah, and we found, through the trials and tribulations, which it's hard to believe that now Revelar's a 30-year anniversary or birthday, but we found that putting these together gives us an additive growth response, or even a synergistic versus using them separately.
Yeah, because they have a different mechanism of action. You may get a 10% growth response or 15% growth response with an estrogen, get a 10 to 15% response with an androgen, you put them together and you may get 20 or 30%.
Yeah.
So you more than double the response that you'd get with an individual implant.
Yeah, and if they're gaining 2.5 pounds or 3 pounds a day or 2 pounds a day on grass as a stalker, I mean, you're talking 0.6 of a pound a day, or anywhere from 1/3 of a pound a day to 1/2 pound a day.
Exactly. Yeah. So you're looking at 15-20% of the control growth, and so yeah, if they're gaining 2.5-3 pounds a day, that's significant.
Yeah. So when we look at grass or backgrounder implants and the intermediate, those were actually some of the more recently approved products relative to some of the higher anabolic products.
Right. You have the G suffix implants. That those are for grass or growing, and so those implants are available. More recently, we have some longer duration, stalker or growing implants. I guess the one thing I would say, we do have some systems that, like cornstalk grazing, where the cattle might be going to grass later and they're only going to be gaining 1/2 pound a day. And a 10% response of 1/2 pound isn't very much. So in that case, you might save your implant to the period of time where the cattle are really going to be growing faster.
Yeah, and Preston did some of that work that about 1.7 times their multiple of maintenance is where they've got to be energetically to really have an implant make an impact.
Right.
And so just exactly what you're saying. If we don't have the groceries, maybe save the implant. But if we got the groceries, we're just wasting money not doing it.
Exactly, 100%.
It's great stuff, folks. Steroid implants are a tool that's been around for over 70 years. Invented right here in this building. That
like
we're sitting
2 doors down.
2 doors down. And so something that we're proud of at Iowa State, and something that the industry has really used to improve efficiency. So stay tuned. We'll be right back.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Hey, I'm Clark Victory. I grew up right here on this little ranch near Chelsea, Oklahoma. Roped and ranched all my life. A few years ago, I had an injury that created what they call a frozen shoulder. And after speaking with the surgeon in Tulsa, he told me that he could make my shoulder better if he did surgery, but he absolutely couldn't fix it. And I called Kansas Regenerative Medical Center. I did the stem cell replacement. By 12:30, my wife and I had lunch and was driving back to Chelsea. We work around here. Some days we work pretty hard around here, and my right shoulder doesn't get sore. It's like a baby's arm.
When a new calf hits the ground, the clock starts ticking. A belly full of colostrum gives them their best chance, but if they don't get any, time starts running out. That's when you grab a bag of Oxford Ag Colostrum in their patented feeding system. It's simple. You fill it with warm water, shake it to mix, feed it with a tube or a nipple, and you are done. No bucket, no bottle, no mess, and right on time. Ask for it by name or get it online at oxfordag.com.
Success in the cattle business hinges on a lot of different people playing their part. From the vet to the cowboy and the nutritionist to the feed truck driver, you rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to BimetaBiologicals.com to learn more.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson here with my friend and colleague Dr. Dan Loy. We're at Iowa State University in the Department of Animal Science, and Dr. Loy serves as the director of the Iowa Beef Center, and go to the Iowa Beef Center website. If you want to see what I'm biased, but if you want to see the most relevant information for producers that you can use in the field, what Dr. Dan and his staff at the Iowa Beef Center has put together for a long time, it's really good stuff.
Yeah, we work hard to keep it up to date.
And I use it all the time. People call me and ask me a question, I just go and look and find it on the Iowa Beef Center website and kick it over to them. And yeah, it makes everybody's life easier. But we're talking implants, and the one thing about implants, we talked about them being 50, 60, 70 years old, and they don't have a withdrawal.
No.
They do not have a meat withhold. So when people start talking about safety, and you've done some of the stuff on estrogenic activity of different compounds and how little there is in beef, it is amazing to me that we have something we've used for 70 years with no withdrawal and no negative adverse events.
No. The only time that there's a potential for that is if it's not used properly.
Yeah.
If it's not implanted in locations that are approved, and that's very infrequent, if ever.
And then we're talking about, when you talk about the size of an implant, it's the size of an Advil.
Mm-hmm, sure.
For an 800-pound beast for 120 days, not a 160-pound human for 4 hours.
That's right, and that small amount of compounds going to increase their growth rate as much as 30%.
So let's talk about finishing cattle, and we've got the two segments here, and I thought we'd talk about implants in the finishing phase, and then we'll get into some of the extended release products. But talk to me a little bit about implants and finishing cattle.
Well, this is where you get the most bang for your buck. The last 80 to 100 days you own the animal is when it's going to pay off the most. And so regardless of what you do prior to that, getting an implant in that animal's ear, the last 100 days or so is going to be your most benefit. We're talking, at 25% increase, cattle gaining 4 pounds a day, that's a pound a day. And that you can visually see that in studies where you have a non-implanted control versus implanting.
Yeah, it's amazing to me when you and I get to watch growth data,
mm-hmm.
and when they start coming in, and a week later, they're weighing, they're gaining 4 pounds a day or something of that nature, and you're seeing them gain 20, 30 pounds a week.
Yeah.
It's absolutely amazing. Especially you look at a month and they're like, hey, those aren't even the same cattle.
It's incredible. And one thing we get asked is, well, let's say I own this animal. We talked about stalker and calf foot implants. What if I own them through their lifetime? Well, you may get a little more response for a terminal implant if they hadn't been implanted prior, but it still pays to implant throughout every segment.
Yes.
If you own them from birth to finish, I would implant them calf hood, I'd implant them in grower or stalker, and I'd implant them in the feedlot as well.
And what we see is that diminishing return, that payout of that implant. The reason when we re-implant, we can maintain a consistent approach. And if you do proper implanting through the life cycle of the steer, you're talking almost $200 a head.
Oh, at
advantage.
Least. Yeah, at least. With current feed costs, it's probably more than that.
Hard to pass that up, folks. So I'm glad we're talking about it today. We're going to take a break. When we come back, we'll talk about some of the extended release and re-implant strategies. We're here with Dan Loy at Iowa State University. Stay tuned.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed LidoBand, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. LidoBand, a small device that can make a big difference.
The cost of an open cow these days very expensive. It's hard at times to dedicate a half a day or a whole day to leave your practice to go palpate cows. And so alertness test has helped speed the process up of getting preg rates back to the owners. And so free up time for diagnostics or working in your clinic. It also will help generate revenue, not being on site to do the testing.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrosyn by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrosyn.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrosyn.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson and Dr. Dan Loy. We're here at Iowa State in the Department of Animal Science, the building that Dr. Wise Burroughs patented and invented the first use of a steroid implant in cattle.
That's right. And when that was rolled out in late 1940s, the Cattle Feeders Day, there was 1,000 cattle feeders that came to hear his talk.
It's amazing, and we're blessed to somewhat carry on his traditions and here at Iowa State and talk about implants and so when we start to think about the technology and how it's changed from those days in the late 40s and early 50s to now to 2023, probably one of the bigger changes was the extended release.
The extended release has been a big factor, and you know, for one thing, it cuts down on the need to run cattle through the chute a second time, reimplant when they're heavier, and you know, there's maybe some savings in terms of labor, some savings in terms of stress on the cattle and that type of thing. And the response to those 200-day implants is very comparable to a reimplant program.
So kind of describe how those work, what an extended release implant, because every company has one now, but kind of talk to me about how that works.
Yeah, it kind of depends on the implant.
Yeah.
While the first extended release was estrogen only, that was embedded in a matrix, a silicone plastic matrix that just releases slowly over a 200 or 300-day period. More recently, the combination implants, there's two of those that are out there. The first one is basically a moderate combination implant that is released right away, followed by or along with a terminal implant that's coated so that it doesn't start to release until after 70 days. So you basically get the same result as if you had implanted those cattle at the beginning and then re-implanted about 70 days later. The third type is similar to that, but basically releases slowly over a 200-day period or so.
You know, it kind of trickles out.
Yeah,
just consistent. So, you know, I could see, especially even different times of the year, you know, if you know you're going to need to reimplant in July, August, and you're going to be limited on the time of day because of heat stress that you can run your processing barn, kind of some forward planning to use those types of products.
Right. You know, I've always talked about, you know, in developing a strategic implant program is to start with a market date and work backwards, because like we said earlier, you're going to get your most bang for your buck if you have the right implant in at the end. And so that's where it's important. So if you have a longer period of time, that's where these types of implants really pay for themselves.
And as we leave, proper procedures and applications vital.
It's incredibly important, and all of the implant companies can help train your crew, can teach you about the proper methods to do that. Here in Iowa, you know, we have some times where we can get some dirty ears and muddy ears, and using good cleanliness and cleaning those ears is really important to get the most performance.
Yeah. Well, folks, a wealth of information. Dr. Dan Loy, steroid implants, use them throughout the life cycle. Different products out there. work with your nutritionist, go to places like the Iowa Beef Center to learn more about how and when to implant and what products to use, and be looking too for the regs that are coming up in June to make sure that you're legal in your operation. But thanks for being on the show.
Happy to do it.
Thanks for watching. Remember, always work with your local veterinarian. And if you want to find out more about what we do on DocTalk, you can find us at www.doctalktv.com. I'm Dr. Dan Thomson with Dr. Dan Loy at Iowa State University, and we'll see you down the road.
DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.
Plant the seeds of financial security today with United Patriot Coins Precious Metals Starter Pack, the Patriot Pack. Exclusive offer for our DocTalk family. Call now and secure your financial future. Strengthen your roots with silver and gold. Call United Patriot Coin today and ask for the DocTalk special offer.